The automated counter would examine thousands of cells, but then translate that information in statistical data that are very, very, very useful to unraveling pathology. Nowadays, almost all the regional hospitals have automated blood cell counters. That's how available they are in the world at large. And yet, the understanding of their results lag behind their availability. So I intend to use this to bridge the gap or close the gap between understanding and using the results of the automated blood count and its accessibility. It's very accessible now. As you click through, you will be able to match all the abnormalities in the clinical case presentation, the automated counting report, and then the smear. And once you put that together, you have a three-dimensional picture of what's going on.
Welcome to this course on Mycobacterium ulcerans infection, commonly referred to as Buruli ulcer. This course has been designed for medical students, practicing doctors, and field workers who wish to learn more about the disease. In this course, you learn about the general aspects of the disease, including what causes the disease, where you can find it, and then there are a series of cases explaining the different forms of the disease to help you in making a good clinical diagnosis. There is an animation explaining the pathogenesis of the disease and a series of videos explaining how to obtain samples for laboratory diagnosis. Finally, there are a series of cases explaining all the difficult or different issues you are likely to encounter in clinical practice. At the end of this course, you should be able to accurately make a clinical diagnosis, take samples to confirm the disease, and manage the disease properly.
Good morning and welcome. This is your first time you're doing your clinical methods in ENT, is that right? Yeah. And what I'd like to do this morning is to go through some of the kind of specialized instruments we use in ENT and introduce you to them, show you how to use them, and then I will demonstrate a couple of tricks and procedures that you need to be able to do, and then you're going to divide up into small groups and be allocated a set of instruments and otoscopes and headlamps. And then I want you to practice on each other for about 20 minutes, and then we're going to give you patients for the rest of the morning for you guys to examine and present. Okay. Do you know any causes of hearing loss?
Yeah, I mean, you've got to separate between conductive and sensory neural causes.
Excellent, yeah. So essentially it's two big groups. The conductive group, where there's a problem either with the sound waves being transmitted down the ear canal, through the tympanic membrane, through the ossicles, and into the cochlea. So that's conductive hearing loss. By far, probably the most common cause of hearing loss that we can do something about. Then, as you mentioned, the sensorineural hearing loss, where there's a problem with the cochlea or the nerve or at the brain level. And as we age, unfortunately, these fine hair cells in the cochlea are very sensitive to aging, and these decrease in number. So certainly sensorineural hearing loss due to aging is a common cause of hearing loss. But what we see mostly here that we can do something about is conductive hearing loss. So how can you tell the difference between sensorineural and conductive hearing loss?
Hello, I'd like to introduce you to this site, which has been developed as an open access educational resource with medical students in mind for teaching of the mental state examination. All the cases that you're going to see are simulated. The actors are all clinical medical students at the Kwame Nkrumah University of Science and Technology in Kumasi in Ghana, except for the doctor, who is a resident in psychiatry at the Konfo-Notche Teaching Hospital. I'd like to suggest that you use this site in the following way. We've included a PDF file which gives you the format of the mental state examination, which I suggest you use. I'd like you to look at that and then watch each video in turn, making your own notes about the symptoms and signs that are elicited in each case. You can then compare your own notes with the scripts that were actually used by the actors as the basis for their characters. Each mental state examination illustrates a different condition. The script will tell you what that condition was. And if you're feeling really adventurous, you can always make a list of differential diagnoses based on your own mental state examination and then compare that with the script. I hope you really enjoy this site. It's meant for you to have fun. Good luck.
Welcome to this interactive computer-based learning program. This is a program that's primarily meant for undergrad medical students to be able to understand the procedure of a Caesarean section, the indications for Caesarean section, as well as the complications and post-op management. It can also be used by non-specialist medical officers who would like to review the steps of a Caesarean section and just get some continuing medical education on the topic. On this program, you discover some links which are in blue. When you click on these links, you can get cases that are about patients in labor who needed C-sections, and also get videos on the procedure. And at the end of it all, there's a self-assessment quiz which would assess how much you've learned from this program. And that would help you know which areas of the procedure you need to review and how to come out with the best possible understanding from the program.